The ABC of type 2 diabetes. The ABC triangle demonstrates 3 things your GP or practice nurse will be measuring as part of your annual review. The A is for your HbA1c. This is the blood test they take from your arm to see what your average blood sugar levels have been over the past 3 months. The B is for blood pressure and the C is for cholesterol. But why do they do these tests? It's because the results can indicate the likelihood of long-term complications from diabetes, including your risk of heart attack or stroke. If your results are higher than they should be, then action can be taken to lower them, and this will reduce your risk of complications. Let's talk about each one in a little more detail, starting with HbA1c. This is the blood test used to find out how much glucose is attached to your red blood cells. Here's a red blood cell, and the chains of white spheres attached to it represent glucose that has bonded itself to the red blood cell. In someone with diabetes, we see a lot of glucose attached to red blood cells, as shown in this model. When looking at test results, a result of 48 millimole per mole or above is a diagnosis of diabetes. Your GP or practice nurse should do this blood test for you at least once per year to monitor your diabetes. But how do you know if you're managing your HbA1c well? The guidelines tell us that if your HbA1c is between 48 and 58 millimoles per mole, your diabetes is under good control. If your test result is 42 to 47, that is the pre-diabetes range, where your sugars are higher than normal, but not quite in the diabetic range. If your HbA1c is below 42, then your blood sugar levels are normal. It's really useful to know your test result, and many surgeries allow patients to look at their test result online now. You can usually ask your GP's reception if they can give you access if they haven't already. Moving on to blood pressure now. Your blood pressure should be monitored from time to time to check if it's within a safe range. That's because high blood pressure increases the risk of heart and blood vessel problems, also known as cardiovascular problems. People living with type 2 diabetes often have high blood pressure, partly caused by having high sugar levels in the blood. And high blood pressure can damage the body over time, especially the eyes, kidneys, and feet, speeding up the long-term complications of diabetes. Lowering high blood pressure will help reduce these risks, and it can be achieved by making lifestyle changes and taking blood pressure medications. So what is a healthy blood pressure? Guidelines state that we should aim for a blood pressure no higher than 140/80. However, if you have a personal history of eye, kidney, or cardiovascular complications, 130/80 is a safer upper limit. Back to the ABC triangle, and let's now talk about cholesterol. So why is it useful to know your cholesterol level? You may well have heard of plaques, which form in arteries when LDL or bad cholesterol is too high. Unfortunately, diabetes raises your risk of developing these plaques due to the inflammation of the artery walls caused by high sugar levels. LDL cholesterol likes to stick to this inflammation, making plaque formation more likely. In this cross-section of an artery in the body, you can see the cholesterol plaques on the walls. In this diagram of an artery, you can see how the plaques are making it harder for blood to flow through. In addition, bits of plaque can break off, causing blood clots which then travel around the body and potentially lodge in areas where they could cause heart attacks or strokes. Taking a type of medication called a statin will help to lower your cholesterol and reduce the risk of fatty plaques breaking off from the walls of your arteries. If you experience side effects from your statin, talk to your GP or practice nurse, who will be able to prescribe a different statin, as there are several available on prescription now. Lifestyle changes can also help to reduce your cholesterol. So what is a safe cholesterol level? The guideline for healthy total cholesterol, if you're living with diabetes, is 4 millimole per litre or under. For people who don't have diabetes, this number is a bit higher, but when you're living with diabetes, the extra risk of heart attack and stroke means that 4 is a safer target to aim for. You may want to discuss this with your GP or practice nurse if you notice your total cholesterol test result is above 4. So, to summarise the ABC triangle, it includes HbA1c, blood pressure and cholesterol. These are 3 important tests the GP or practice nurse will arrange for you at least once per year. And we recommend knowing your numbers so that you can keep track of your health and progress. If you want to improve your HbA1c, blood pressure or cholesterol, you'll find lots of tips in our videos on these topics online. Thank you for watching.